so that we can commence the program. Lokesh, Ankit, can we start the program? Maybe you can shut the door so we can. Is there an echo? There is. Hello, check. Good evening, ladies and gentlemen. I, Khyati Naravne, I think there's an echo. Good evening, ladies and gentlemen. A very warm welcome to all the dignitaries. I take immense pride to extend hearty welcome. There's a lot of echo. I take immense pride in welcoming the members of the FTCCI, members of the Managing Committee, past president, experts and contributors that we call the architects of the Vision 2030 document on quality and affordable health for all in Telangana. We also welcome their family members who have joined us today, all the award winners, government officials, special invitees, press and media. A special welcome to our chief guest, Sri Somesh Kumar IS retired, Chief Advisor to the Honorable Chief Minister of Telangana, who has taken time out today to join us for this event. So thank you so much for gracing the occasion. And we have had at the FTCCI various opportunities to work with you when you were the Chief Secretary, whether it was to address the challenges faced by the exporters or talk about the food processing policy that was released or the recent HR award that we organized. So thank you so much, sir. You have always been a great strength of support to the FTCCI. I also take pleasure in welcoming Padma Bhushan, Padma Shri Dr. G. N. Rao, Chairman, Founder, Chair, LV Prasad Eye Institute, Hyderabad, as our special guest. Thank you so much, sir, for gracing the occasion. Thank you so much for accepting our invitation. And Sri Subodh Dean Aski, who has been a partner to the FTCCI. So thank you so much. We also have Padma Bhushan Dr. D. Nageshwar Reddy, who would be joining us in a short while from now. We are thankful for the invaluable support of our partners, our associate partners, ASCI, LV Prasad Eye Institute, Hyderabad, AIG Hospitals, Relicis Medical Devices Limited, our industry partners, Chain Foundation and Prompt Packaging Private Limited. Thank you so much to the partners so that we could organize this program as well as come out with the vision document. A heartfelt congratulations to all the award winners across the 15 categories. Before we invite the dignitaries onto the stage, we would like to show a short film of the FTCCI because we have a lot of non-members and doctors who have joined us today, probably for the first time at the FTCCI. So we would like to show you a short film of FTCCI and commence the program. Thank you.
1917, the year when a dedicated organization, the Deccan Chamber of Commerce, was formed to encourage trade and commerce activities. The historical journey of the organization has witnessed great transformation as per the changing needs of the industry and businesses. The Federation of Telangana Chambers of Commerce and Industry, FTCCI, a legacy of excellence, voice of the industry, representing interests of over 25,000 businesses of all sizes, sectors and regions, is empowering industry and trade of Telangana state. A world leader in pharma, a global hub for vaccine, home to all major MNCs, leader in IT exports, and emerging first stop of India. FTCCI advocates a pro-business environment, caters to the needs of MSMEs, budding entrepreneurs and traders through its advisory services in taxation, market information, industry-related issues, B2B connection. The Chamber has its nominees in the state-level advisory committees to help drive business productivity. FTCCI aids in providing certificate of origin for exporters, issues visa recommendation for business travels. The Federation imparts job skills through its dedicated skill center. It has adopted 14 government ITIs to improve the employability of students. With a uniquely global perspective, the FTCCI events reach a highly engaged audience, policymakers and stakeholders aiming towards Atmanirbhar Bharat.
FTCCI to work with government, tell us and guide us कि हम लोग क्या कर सकते हैं to remain competitive, to remain better than our competition. FTCCI for joining us, and I thank the office bearers of FTCCI for inviting me. Jai Telangana, Jai Hind.
Come and be a part of this dynamic and proactive organization. Together, let's realize the vision for a progressive future.
I request the guests and honorable guests and the guests of honor and our office bearers to start the program by lighting the lamp. And now I request our President Shri Anil Agarwal to accompany our Chief Guest Shri Somesh Kumar Garu, Chief Advisor to Chief Minister Shri K. Chandrasekhar Rao Garu onto the dais. And I request also our today's guest of honors, Dr. G.N. Rao garu, Padma Shri Dr. G.N. Rao garu, Chairman, Founder, Chair, L.V. Prasad Eye Institute of Hyderabad, to please come on to the dais, sir. And I request our Senior Vice President, Meera Jaydev garu, to accompany him. And I invite Mr. Subodh Kandamuttan, Dean, ASCII and Knowledge Partner, to please come on to the stage, sir. I invite our Chair of the Committee, Health Committee, Sri Shekhar Agarwal garu, and also Vice President of FTCCI, Sri Suresh Kumar Singhal garu, to please come on to the stage. Thank you all the guests and the dignitaries on the dais for gracing the occasion, and I now request our President to please welcome all the guests by presenting the plant. To Shri Somesh Kumar garu, Chief Advisor to Chief Minister, Government of Telangana. To Shri Padma Shri Dr. G.N. Rao garu, Chairman, Founder, Chair, L.V. Prasad Eye Institute. To Mr. Subodh, Dean, ASCII. Thank you, sir. And now I invite our President, Sri Anil Agarwal garu, to give the welcome address.
Good evening. Honorable Sri Somesh Kumar ji, IAS retired Chief Advisor to the Honorable Chief Minister and former Chief Secretary. Padma Shri Dr. G.N. Rao ji, Founder Chairman, L.V. Prasad Eye Institute. Dr. Subodh ji, Dean, ASCII and our knowledge partner. My colleagues, Sri Meera Jaydev and Sri Suresh Singhal ji, Managing Committee members, past presidents, vision architects, guests, press and media and friends. Hearty welcome to all of you to this vision document release program. It has been a great journey since last 3 months. The journey has been undertaken by our health chair, chaired by our past president, Shekhar Agarwal ji. Sir, in the last 9 years, the state's healthcare system has made significant strides with substantial increase in the health budget of the state. There is visible improvement in the healthcare with setting up of state-of-the-art diagnostic facilities, teleconsultations, basti dawakhanas, new medical colleges in every district, increased MBBS and PG seats, establishment of super speciality hospitals in Hyderabad, Warangal and many more. I commend the vision and efforts of our Honorable Chief Minister in leading the state to become #1 in many aspects, including health sector, sir. The state is ranked as 3rd best performing state by Niti Aayog. Effective implementation of schemes like KCR Kit and Amma Audi have improved the maternity care facilities and welfare of mother and child. It is a fact that people are preferring going to government hospital for childbirth as the government is insisting that delivery should be normal unless it is absolutely necessary to undergo C-section. The support and the guidance which we have received from Padma Bhushan Dr. Nageshwar Reddy ji and Padma Shri Dr. G.N. Rao ji is unprecedented, and no words match the depth of our gratitude to them, sir. Sir, I am sure if Telangana government hires one of the top 5 research organizations like KPMG, E&Y, PwC, etc., you would not get as quality document as Vision 2030. The document reflects the amount of work and dedication that the architects put into it. FTCCI is truly and fortunate to have Sri Shekhar Agarwal, our past president, as chair of the health committee. He led the preparation of vision document, and everyone here will be surprised to know that he worked for more than 12 to 13 hours a day for the last 2 months, and he was meeting doctors, government officials, public health experts, media, NGOs, insurance experts, and various stakeholders in preparing this document. I also appreciate Dr. Sanjana for her passion and dedication, one of the team members of our health committee, who along with Shekharji worked every day till late night. And one intern, Ms. Deepika, she also contributed in preparing this document. The document contained 15 recommendations, and my sincere request to the government is to implement them for the benefit of our people. So much of hard work has gone into the preparation of this document, and I thank each and everyone involved in the preparation from the bottom of my heart. I think they deserve a big round of applause. Thank you, sir.
As mentioned by our president just now, a lot of hard work has gone into the preparation of this document, and we would like to show the snapshots of the various activities done by the health committee under the leadership of Shri Shekhar Agarwal garu. To have a glimpse of that, we are presenting a 1-minute video of activities. So that is only a shortlisted list of the people whom our Shekhar Agarwal sir and with his team met. So now I invite Dr. Subodh Kandamuttan, Dean ASCII, to present the highlights of the report or the document 2030. And before that, I am pleased to introduce Dr. Subodh to the audience. He is a Dean and Professor of Center for Healthcare Management at Administrative Staff College of India, Hyderabad. He is a doctorate in health economics with 18 years of experience in health economics, health financing, and health policy. He works closely with the national and state governments in India in numerous policy level projects in health policy and financing and monitoring and evaluation. Sir, very happy to have you here, and I request you to please give the highlights of the document.
Thank you. Respected Sri Somesh Kumarji, Advisor to Honorable CM of Telangana, Dr. G.N. Rao, Founder LVPI, Sri Shekhar Gavalji, FTCCI Past President and Health Committee Chair, Anil Agarwalji, President FTCI, Dr. Srimati Khyati, CEO, Sri Sureshji, Sri Meelaji, and other respected dignitaries who are amidst us, colleagues and friends. At that outset, I would like to, on behalf of ASCI and FTCCI, I would like to thank FTCCI for giving this opportunity as a knowledge partner for this important document on the Vision 2030 on quality and affordable health for all. I would like to talk a little bit about the vision document, on why it was started, what is that the relevance we have, and then we'll talk a little bit about the recommendations. As Anilji already mentioned, Telangana is already ranked number 3 in the healthcare among the states after Kerala and Tamil Nadu, and this has been achieved ever since the 9 years. So first of all, a huge round of applause for the state for doing that. Now there will be a question why we need a vision document when Telangana is already doing really well. But we thought that we need to excel much more. We have made huge improvements. I think I always believe as a health professional that if you can improve your infrastructure and manpower, 50% of your problem is solved. And that's something Telangana has done continuously in the last. Every district now has a medical college. Every, a lot of, I think we have heard news about assistant professors being added to all these medical colleges. We're tackling that, the healthcare professionals issue. We are actually now dealing not just about primary care, secondary care, and the tertiary care. We are also looking at the quaternary care, which means we have a lot of 5-sector care, right from the villages to the super specialty hospitals. My previous speaker already talked about the innovative schemes, and there were just few. I think we have the KCR kits to improve the institutional delivery, Amma OD scheme, Kandi Velugu scheme, the midwifery program. Some of these are innovations which even other states can actually replicate, and these are all originated in Telangana. We have the Basti Davakhanas, we have Arogya Lakshmi scheme, we have Telangana Diagnostics, Telangana Dialysis, you have Ayushman Bharat, which has now been integrated with Ayushman Bharat, which is actually going to give a much larger coverage. And always remember that Arogya was started in earthwise Andhra Pradesh, and Telangana has always been a pioneer in the Arogya scheme, not just for the BPL population, but also it is now extended to the journalists, to the state employees. It's almost going towards universal health coverage. We do have universal screening of anemia initiative in Karimnagar, Arogya Lakshmi scheme. We have also Baliga Arogya scheme. So I think what Telangana has done in the last 9 years is target not just the tertiary care, where we know Hyderabad is a hub of medical institutions, both public and private, but also target the primary care and secondary care. The trust in government hospitals have actually increased over a period of time, and you will not disagree with me, Hyderabad is one of the most preferred medical destinations in the country. Now, what did we do with Vision 2030 in healthcare was to go one step ahead. We wanted to ensure that what can be done to ensure quality and affordable healthcare to everybody in the 4 crore citizens of Telangana. That's what, and there is a big catchword, I think with Niti Aayog also has highlighted, is the missing middle class. So we have a very huge scheme to target the primary care, the below poverty line, the elderly population. What happens to the high income class? They also have the income to do that. But what happens to the missing middle? That's something we wanted to thought. And what did we do to do that? And why I'm highlighting this is because as one of the things, unlike an academic institution, I think there were other, the past president also talked about Ernst EY or KPMG. We did not do it like a typical academic institution. What we did was to consult all the stakeholders. The amount of stakeholder consultation that has gone on this report is innumerous. Like we have actually had more than 10 to 15 panel discussions, and we have met 100. FTCCI team already met in person many of the doctors. We had 17 allopathy departments which were covered. We had 3 Ayush departments. I think Madam Prasad is there. I think she herself has attended multiple rounds of discussions. So So that sort of involvement I have not seen any other academic document. So this has come with a lot of involvement. We have had meetings right from 8:30 in the morning to 8:30 evening. We have had academicians, public health experts, we had specialists from allopathy and Ayush, and a huge kudos to all of them for contributing. We had health insurance experts, health technology experts, NGOs, the media not just for reporting, but also to ask them what they felt was their vision for 2030. And what we have actually done is to put together, so what our job was as an academic institution, as a knowledge partner, was to put together some of these recommendations and come out with a sort of a recommendations which Telangana government can take it forward. We also documented some of the best practices. So we have Dr. G.N. Rao here. There are some beautiful best practices even in Telangana where we can learn lessons. L.V. Prasad Eye Institute, C.C. Shroff Memorial Hospitals, St. Teresa's Hospital, Nayak Hospital in Chhattisgarh, Arvind Eye Care, Narayana Hridayalaya. So we documented some of them and looked at some of the best practices where we could actually do. I can actually go on and on the methodology adopted, and each of these departments under the guidance of very eminent doctors have given some of this vision. But what we have done is sort of looked at all those stakeholder consultations and come out with very strong recommendations which could be done either at a short-term level or at a long-term level with future consultations. One of the things which really came out, and I'm sure when you open the report, I think you will be looking at that, is actually the two important aspects was about, I think everybody, I think in spite whether it's an allopathy doctor or an Ayurveda doctor or a media, everybody talked about awareness. They said healthcare has to be given awareness right from kindergarten to the postgraduate. I think post-COVID, I think that's something, awareness has been very important. And not just that, lifestyle disease, nutrition, anemia. Telangana is a state, unfortunately, we have 50% of the people in anemia. There are a lot of initiatives being done, but 50% still a larger number. And high school children, college children, getting awareness about anemia is very, very important. We should do mandatory regular screening among school children, which already is being done as part of school health. But there was a very interesting suggestion about there should be a focus on moral science and physical fitness, which I think a couple of years back was there, but has not been there. The other important aspect, I want to really stress on this, and this has been universal across all the stakeholders we met, I think almost 30, 40 of them, they said prevention is the key. The whole focus, I think when every state will focus on the tertiary or the super specialty, the focus has to be on the primary care. It could be on the healthcare awareness. It should be on how to incentivize prevention. See, there are incentives for institutional delivery. There are incentives to, bringing them to the hospital. But how do we incentivize or disincentivize this? So there was this doctor who said, like, if they are not physically active, there should be some disincentive that they don't get the services, something like that. So basically get into incentives and disincentives. One of the other important, interesting aspect which came in was to bring in the rebuilding community trust. I think this is universal. I think this is what NHS has taught us, is to build the community trust on the healthcare system. The whole concept of family Telangana has been one hub, I think, right from 2007 and then later from 2014. The integration between public and private sector has been wonderful. I think we need to strengthen that more, not just at the tertiary level, but also at the primary level. One of the other important aspects which came was about the medical education. We need to have clinical acumen with hands-on experience. How do we integrate private doctors, private facilities to come and work with the government? Because at the end of the day, medical education is very important. We need to have state-of-the-art institutions. So we already have NIMS, TIMS, there are Gandhi hospitals, Osmani hospitals, they are really, really good. But we may have to create some more state-of-the-art, like the Jayadeva Institute or some other institute or NIMHANS, where we should actually, in Telangana, we could have some of them. There was another important thing where Telangana has done extremely well, but can be taken forward, is the digitalization of the technology, the artificial intelligence. I think that's another area we thought very, very important. Last, I think one of the things which, there are a couple of other points, but one point I would like to close with, another important point was all about the allopathy and Ayush. I think excellent, I think everybody knows allopathy has been really good. I think we are one of the best, but Ayush has a lot of potential. And there is a lot of interesting discussion with them, and everybody is unanimous saying that one of the things as Ayush department we can do is to validate some of their medicines and systems. Sir, I think we are confident that I think some of these recommendations can be taken short term, some can be taken a little long term with some of the consultations. But one thing I can assure you, sir, all the stakeholders who actually participated whether it's from the public sector or private sector, wanted Telangana to really do well and become the best in the country, sir. Thank you very much, sir.
Now I request our chief guest, Sri Somesh Kumar Garu, and the other guests on the dais to please release the document 2030. That is each book. This is one book. Everywhere. Thank you. And now I invite Sri Shekhar Agarwal Garu, Convener Healthcare Committee, to give the theme address.
Our today's chief guest, the Chief Advisor to the Honorable Chief Minister and the former Chief Secretary, Mr. Somesh Kumarji, IAS retired. Special guest, Padma Shri, Dr. G.N. Raoji, Dean, Administrative Staff College of India, and our knowledge partner, Dr. Subodji, our dynamic President, Anilji, Senior Vice President, Jayadevji, Vice President, Sureshji, Managing Committee members, past Presidents. I think we should have a 1 minute here. Everyone is going through the vision document, so it's really worth going. It is really worth. Okay. And most important are the vision architects. Before going ahead, can we have a round of applause for all the vision architects, all the doctors? Dr. Prashanti is there, her team of Ayush is there, and many of the doctors and other experts. And then our guests, press and media and friends, a very good evening to all of you. Friends, the government of Telangana deserves immense appreciation for its remarkable achievements in the healthcare sector. Under their visionary leadership and proactive governance, the state has witnessed significant advancement and notable improvement in healthcare accessibility, quality service, and many more. I like to congratulate our Honorable Chief Minister Chandrasekhar Rao Garu for his dynamic leadership and relentless efforts which have played a major role in the state's progress, particularly in healthcare. His dedication to public service and commitment to improve the lives of people of Telangana are truly commendable. I like to extend my sincere appreciation to our chief guest today, Shri Sumesh Kumarji, for his invaluable contribution as the Chief Advisor to the Chief Minister and the former Chief Secretary of Government of Telangana, especially, sir, during the COVID period. His vast experience and deep understanding of governance has been instrumental in driving the state's progress to the next level. Can we welcome our Chief Guest with a round of applause? Sir, thank you very much for being with us this evening. Friends, I would also like to express my heartfelt gratitude to our very special guest, Dr. G.N. Rao Garuji, for his mentorship and consistent guidance to us. With his expertise and dedication, he has set new benchmarks in the best eye care, and through L.V. Prasad Eye Institute, which is inspiration for everyone in the world. Big round for applause for Padma Shri Dr. G.N. Rao Garu, and we have got Dr. Prasad ji here. Let's give a big round of applause for both of them and L.V. Prasad. And I got a message, sir, for you from USA. One of our friends has written, if it is worth listening, if you ask me to name one role model for me, my first choice is Dr. G.N. Rao. And he is just not a good doctor alone. We would call him a medical social scientist. Living his lucrative practice in one of the greatest nations in the world, USA, he came back to India with his wife on a mission how to offer cost-effective yet excellent eye care to even a common man in rural areas. This visionary and missionary person created one of the greatest models for offering eye care to the developing nations, and his model is discussed widely in the best of the business schools all over the world. How many of us know that today 60% of the patients in L.V. Prasad Eye Institutes are offered the best eye treatment for free of cost? It is especially relevant when we are talking of universal health care. He developed a model where patients are identified at their home base and treated in a 3-tier model. May God give him and his wife and his team all the blessings and energy in their noble mission. So certainly deserve a very, very big round of applause. And the person who has sent is none other than Padma Shri Dr. A.G.K. Gokhale. He's in USA, so we're missing. And big round of applause, sir, for you. And sir, friends, they have treated maybe more than 3.25 crore citizens since 1986, and on record more than 50% are free of cost. So it is a good model for all of us to learn, not only to listen and clap, learn and take it forward, because whatever time is there. And then I have replied him, which I am not reading, that Dr. G.N. Rao is a living God with us. So here the thing is, lot of things to learn. He is with us. Let us have the learning and pass on to the next generation. That's what is our job is. Thank you very much. Now I would like to acknowledge the guidance and contribution of our Vision 2030, our chair Dr. Dwarkanath ji, Bhushan Dr. Devi Shetty ji, Padma Shri Dr. Gokhale ji, and many other eminent doctors and experts for creating this Vision 2030 quality and affordable healthcare for all Telangana. The purpose of the report is to prepare quality, actionable Vision 2030 report, providing patient-centric, easy, accessible, affordable, quality health care to all citizens in Telangana. With like-minded partners and associations like Administrative Staff College of India as a knowledge partner, L.V. Prasad Eye Institute, and AIG as associate partners. the report addresses equity, disparity, and pains of the patient. It promotes better health and well-being and help in creating a patient-friendly environment. It helps to improve awareness and trust in public healthcare system and overall healthcare system for Telangana to become the best health destination and medical hub. Sir, more than 100 doctors and professionals, health experts and other experts have selflessly worked for this vision document. The chief mentors and guides are Dr. Reddy sir and Dr. G.N. Rao sir. With opportunity to interact and learn from the best of the experts and with my limited understanding, I would like to submit the following point, sir, for your kind consideration. Number one, sir, the most important is prevention. Again, Dr. Gokhale says for health there are 3 important rules. Rule number 1 is prevention, number 2 is prevention, number 3 is prevention. He says if 4 crore citizens fall sick at one time, no infrastructure can handle it. So best thing is a prevention. Sir, in the schools and universities, many subjects we study are not useful for later years of our life, and whatever useful we never study in our school. The second point is, sir, that USA, biggest economy of the world, 20 trillion economy, spends 20% of its GDP on healthcare. India, we say we spend hardly less than 2%, and we always say we should spend more. Nothing wrong in doing this, we must do it. But sir, even if 100% of our GDP, if we spend on our healthcare, will it ensure a good healthcare for all of us? No, sir, it will never be. It will be doing. So, sir, the best thing what it came out is we have to develop the sanskara, and sanskaras can be developed from the schools. And so, from KG to PG, sir, it is suggested, and Dr. Subodha has also told, already described, that health and moral science education must become part of school and colleges curriculum from KG to PG, which will improve personal productivity, national economy, and country as a whole. So very simple, but a very important point is, and friends, another next important nowadays, mental diseases are increasing. Again, the moral science is going to help there, and also the character of each and every one of us. Now, second point, sir, is in earlier times we had immense trust on the doctors and healthcare systems. Now the public trust is totally shaken. A good civic and civil society runs on trust. So for our next generation to have their life and to live their life better, we have to have trust in the society. Sir, to rebuild the trust in the society, for the doctors and healthcare system, family clinics can be restored on topmost priority. More master and diploma courses seats can be assigned for the family medicine. Sir, similar to Arogya Shri and Ayushman Bharat, the government can provide health insurance to all citizens. Citizens above poverty line can pay affordable premium for the insurance like COVID vaccine. COVID vaccine below poverty line, government provided free, but all of us paid about 1,000 rupees or something, and we were happy to pay. So here also we will be happy to pay, but everyone would be covered, sir. Sir, government hospitals infrastructure and services can be strengthened, enabling affordable treatment for all patients, including above poverty line. They can pay affordable amount for their treatment. Their payment would improve the trust, quality, accessibility, and also the government finance. Sir, patients must have choice to use government or private healthcare facilities. Directly or indirectly, it should not be thrusted on them. It should not be thrusted on them. Sir, example is good cup of coffee is available for rupees 20 rupees, 100 rupees, or 500 rupees for all pockets and everyone. And sir, everyone is happy on that. So must be the healthcare for all pockets. And live example is, sir, LV Prasad Eye Institute. They offer treatment for free. They offer for 1,000 rupees. They offer for 500 rupees. Just giving example. person who's paying 500 is actual paying his cost 1,000 rupees, cross subsidizing 0. So everyone gets a health care. So sir, health care must be available to each and every person in India. Sir, in tribal and remote rural areas where the government doctors have got challenged to visit and stay, trained medical assistants can be stationed who are connected online with the doctors in the nearest cities to treat these patients. Sir, whenever the government has got challenge in delivering of effective health care, it can collaborate with private entities in order to offer the patient-centric care. Sir, now healthcare is there either in private sector or public sector. Sir, we suggest that 1/3 of the healthcare system should be encouraged to be in public-private partnership. Sir, cost of medical education must be affordable in order to help the patients to get affordable health care with basic learning of alternate health system during their first or second years of MBBS. Sir, the students can be trained more on clinical acumen and hands-on experience, which the earlier doctors they had. Sir, the doctors from the private institutes, now many good doctors are there, sir, in private institute, and they can be called and invited as the guest faculty. Sir, the government can also create a few state-of-the-art institutes for all teaching and training purposes. And sir, a student must also be encouraged to visit other state-of-art facilities in private institutes. Sir, infrastructure cost and current cost of running the hospital must be able to cater health services to lower, middle and higher income groups. The investment in the trust hospitals like Tata Memorial must be encouraged. Sir, underline trust hospital investment must be encouraged. And sir, very, very important point is, sir, now private equity from other countries must be stopped and maybe controlled, sir, because many private equity investors from abroad, they are coming, investing here, sir, $100 million they invest today, and after 2 or 3 years, they want $300 million, $400, and they want to exit. They don't have any love, affection, and care for the patient. They want only the money. Sir, here, thank you. Here the thing is, sir, I understand USA have banded, sir, time for us to take care of our own citizens and our own brothers and sisters, sir. So, sir, healthcare must be a patient-centric, non-profit centric. The government must provide the best tax concession and lowest rate of interest for the hospital and health care. Sir, not more than 15 to 20% of profit should be allowed for healthcare sector. Sir, while most government policies are beneficial, their effective implementation and execution are crucial for the advancement of healthcare. Sir, there is a huge gap between the manpower required and manpower available. Massive scale teaching and training can help a big way to serve the healthcare sector in Telangana, India and the world, and also to address the challenges of unemployment. There is a huge potential for human service, employment and investment and economic growth in health sector. Sir, as China has become a leader in manufacturing, Telangana and India can become the world leader in healthcare. Sir, good practices from institute like LV Prasad Eye Institute and small scale Shroff Memorial Hospital may be learned and implemented. Sir, Ayush practices have been offering good services over last many centuries. To be relevant for today's world, they must consider to work on the validation of their medicines and systems and the top priority. Sir, allopathy is one of the most scientific way of treatment and is helping the world in a very big way. All forms of medicines have their own strengths and own limitations. Alternate forms of medicines must also be understood to leverage on strengths of each other systems to provide more patient-centric and affordable care. Sir, for health must be considered as fundamental right of every citizen. I request Government of Telangana to kindly, sir, take a lead on that. And sir, they're very, very important. Sir, the time Mother Teresa, she came to India, and one night she was coming back to her home, and it was a bit dark over there, and she hit with something, and she put her torch on there. And sir, right. She put her torch on, and she found there was a person who's lying on the street. Person was very dirty. She called for the help. They cleaned the person. They brought the person at her home, and she kept the head of this person on the lap, and the person was asking for water. She dropped a few drops of water in his mouth, and then he took the last breath of his life. So here is the dignity of death and dignity of life. Can we take the human values to the next level, where we can have humanity, where we can dignify life and also death with dignity? Sir, we also humbly request you to be kindly accept to be the chief patron for the Vision 2030, quality and affordable health for all. So very committedly we assure, sir, about all teams of this architect and our chief architect, Dr. G.N. Rao and Dr. Reddy, sir, will be working with you, and will certainly make Telangana as a healthier Telangana and happier Telangana. Sir, thank you very much for gracing this occasion. All of us here with you. Thank you very much.
Thank you, sir, for that inspiring speech. And before I invite our guest of honor to address the gathering, I am sure all of you knows about Dr. G.N. Rao Garu, Padma Shri Dr. G.N. Rao Garu, and I need not introduce him to any one of you here, but still it is my privilege to read about him a few sentences. Padma Shri Dr. Gullapalli Nageshwar Rao is the founder of the L.V. Prasad Eye Institute. His tireless efforts in establishing world-class institutions and organizations have significantly contributed to the betterment of eye health, not only in Telangana but also in the entire country and in the other countries. Dr. G.N. Rao's innovative approach, compassionate care, and unwavering commitment to service have left an indelible mark on the healthcare landscape. Sir, it is our privilege and honor to have you here, and request you to please address the gathering.
Chief guest of the evening, Sri Somsekhar Garu, Sri Agarwal ji, members of the leadership group of FTCCI, esteemed guests of the evening. I think you have taken an enormous challenge to deal with, to provide equitable and quality care, health care to everybody. Universal health care has been the dream of every country in the world. And indeed, very few have achieved anything closer to that. I was in the United Kingdom just last week, and a lot of discussions centering around how their once exemplary National Health Service is crumbling today because of various influences around the world. A few months ago in The Economist magazine, there was one sentence that attracted me. it said we live in a fragile world, affected by climate problems, pandemics, energy crisis, human stupidity, fighting with each other, and a combination of all these makes everything very difficult and becoming increasingly more difficult as it looks. It is against this background that we have to create a system that takes care of every citizen of the state with high quality and equitable care. When you attend many of the medical meetings, these two words are used very freely: equity, equality. Very difficult words to practice. When we look at healthcare broadly, you talk of universal healthcare, you're talking about prevention, promotion, diagnosis and treatment, that is curative, and then rehabilitation. When we apply these four divisions to the healthcare system that we have across our country, in promotion and prevention, we do well only on a mission mode. When we do it on a mission mode, like polio, more recently COVID. But on a consistent, sustainable basis, we don't do too well. That's where attention has to be paid significantly, as has been pointed out. We recently looked at our own data of work in our primary eye centers. And what we have found out was, if you create a good infrastructure, place well-trained human resources there, and enable them with all supportive systems, 75 to 80% of the people who are seen there don't have to go to the next level. And that translates to enormous economic savings for the individual as well as the family, and on a macroeconomic scale for the entire country. So there is definitely no question that intense focus should be there on strengthening the primary care system. It's not easy. Hardly any doctor would ever like to go and live in the remote areas. Hardly any other professional in the medical sector with a 4-year degree would like to go and live in those areas. So we have to be innovative in creating that workforce to work in these areas. And then integrating the primary care with the upper levels of care. Unless there is that integration, the task would not be completed. If we look at our healthcare system, actually government has all the layers. We have the primary centers, we have the secondary level centers, we have the tertiary level centers. But the deficit is in integration of these sectors. The second area where we do reasonably well is the curative part. We have several islands of excellence across the country. But the challenge is to bring a basic minimum standard of care across the country and across the state. That revolves around considerably on the quality of human resources that we have available. The other segment, rehabilitation, we don't do well at all. I'm sorry to say that. We are just not conscious of disabilities. We have to go a long way in addressing those issues. We can throw money at all things. We can create colleges, we can create hospitals. But the important thing today, in my view, is to create good quality healthcare workforce of all cadres. For that to happen, the first step is to create a cadre of good trainers. There's a lot of deficiency there. They should be enabled. We should create proper infrastructure for training, encourage the trainers, and make them responsible for creating the future generations of healthcare professionals. We're starting lots of medical colleges, lots of All India Institute of Medical Sciences. But from what I hear from my friends working in the AIIMS, their biggest problem is recruiting the right kind of faculty in those institutions. If we don't have the right kind of faculty, whatever else we do, the products that come out of those institutions will not be of optimal quality. So that's where we have to pay attention. Make it attractive for talented medical professionals to seek appointment in these All India institutes and other teaching institutions across the country. Unless we correct that at that level, let us say we go in phases in Telangana, maybe the first phase of 5 years or so, 5 to 10 years, is to just build the training infrastructure while we are trying to improve the care element. All over the world, everybody is making a hue and cry about
really put Telangana on a very good wicket. I would like to also thank Mr. Anil Agarwal, the President, then all others who have made it happen, the Vice President, Mr. Saigal. So all of you who have come, my ex-colleagues, I can see Mr. B.P. Acharya, Mr. Ajay Misra and Prasanthi, they are all there. And so definitely they will also help us to take it to next level. So with this, I would like to thank all of you for giving me this opportunity and also giving me opportunity to listen to this report. Definitely will take it up seriously. Thanks a lot.
Thank you, sir. Thank you. Sir, now, and there are
Thank you, sir, for this address to the delegates. And now,
he is the director of MNJ Hospital. He is a role model in government service. He is instrumental in development of the MNJ Cancer Hospital and bringing the cancer care at the doorstep of the poorest of the poor people.
If we could now have Dr. Raja Rao from Gandhi Hospital's Healthcare Excellence Award for Public Hospital.
Dr. Raja Rao is a superintendent of Gandhi. He is the patient. Because of his services, all the staff in Gandhi Hospital were also there to serve the people. I congratulate doctor for saving the lives of thousands of people in Gandhi Hospital coming from rural areas and twin cities. Photograph.
Right. The next award is Healthcare Excellence Award for Cardiothoracic Surgery. Dr. Gopichand was here, but I think he had some emergency and so he had to leave. Otherwise, you can actually send it to her.
Lowest cost, and especially in Corona period, they were helping many people coming from the rural areas and treating. I know him for a long time. He has been helping our foundation also. Please come.
I think the Padia Diagnostics for the Healthcare Excellence Award in Ethical Diagnostic Care. And I think that's a common theme right across, that almost everybody here embodies ethical practice. Healthcare family physician. Yeah. The next award is actually Healthcare Excellence Award for Family Physician. And if I could invite Dr. L. Rajkumar to come on to the dais, please. Dr. Rajkumar, please.
Dr. Rajkumar has got clinic at, but camps he does free of cost.
And Healthcare Excellence Award in Cancer Prevention to a non-governmental organization. Can I invite Dr. Vasudev Chaturvedi ji to kindly come onto the dais, please?
Mr. Chaturvedi and his team, I'll just tell you, he suffered with the cancer and it is a second life for him. His wife also suffered with cancer, we could not protect. And now instead of crying, he's dedicated his life for prevention of cancer.
Dr. Shesha Shailaja from Karim Nagar.
Healthcare Excellence Award, small hospital.
She gets during COVID period at Karim Nagar District Hospital, coming from rural area. Congratulations, madam.
Dr. Shailaja is also conducting a lot of free camps and conducts regular medical checkups for senior citizens. And same thing, similar thing was there with Dr. Rajkumar too.
The next award is for Healthcare Excellence in Medical Oncology, and I'd request Dr. Senthil Rajappa come on to the dais. He's traveling, but just to say a few words, once again one of the leading medical oncologists It's a pride for all of us here in Telangana and Hyderabad that he is practicing here at the Indo-American Cancer Hospital. So we'd miss him, but pass the award on to him. Next, can I invite Suresh Reddy Garu, Sparsh Hospice, the Healthcare Excellence Award for Palliative Care as a non-governmental organization.
Terminally ill patients.
Yeah, so palliative care is something which again is lacking here, but they have done that. Can I now request Dr. Ranga Reddy for the Healthcare Excellence Award in Public Health to come onto the dais. Dr. Ranga Reddy has actually transformed the way we look at antimicrobial resistance, which is something which is a major health problem when physicians. Can I now invite Dr. Swain, Akar Asha Hospital, another ethical practice, NGO for free reconstructive plastic surgery. It's a completely free charitable hospital. A plastic surgeon who's trained in Nageshwar, went to the UK, worked in Malaysia, and is here now with us. Way we look at birthing in not only Hyderabad but across the country. Dr. Evita Fernandez, Healthcare Excellence Award for Education and Training. And the work she's been doing on midwifery, something which is laudable, commendable, and has been recognized across the globe.
Dr. Evita Fernandez, she is known for normal practice of normal delivery, and she discourages C-sections, and a remarkable job what there is acute shortage of good gynecologists. So government of Telangana, they need 7,000 midwiferys, and they have taken example, and 300 midwiferys so far they have trained, and they are in process of training more midwifery. So it is great service to our state. Thank you very much, doctor, for being with us.
Right, we now come to the last of these awards, but then obviously it is the most prestigious because it is Dr. J.N. Rao, who is not just a local. Sorry, oh, I thought it was the last. Sorry, please excuse me. Mrs. Prashanti, Healthcare Excellence Award for the practice of Ayush, which is so critical.
Big hand to all doctors who are from homeopathy, naturopathy, Unani, and Ayurveda. Thank you very much.
The entire Asia African continent, the only person who has been the General Secretary or Secretary General as well as the President of the International Agency for Prevention of Blindness from Asia, the one and only Dr. J.N. Rao.
Can we give a standing ovation to Dr. J.N. Rao Garu? Actually, just kindly be seated. Great persons who are with us. Thank you, sir, being with us. And just like to have a couple of words for our Padma Shri, Dr. G.N. Rao. He was a successful ophthalmology in the USA, but his heart and mind was for always. He got 5 acres land in Banjara Hills. That time maybe a crore of rupees. I again told you, his cost of subsidizing is 0 rupees. Beautiful model. Since 86, 3.25 crore patients have been treated. More than 50% are free of cost. All of you. And friends, he does not need award. Award needs him. And the thing is, he'll be happy, will be happy the time his principles goes to the society. And somewhere even 10% of it, we started following it, will be.
Thank you all. And now I give a few more minutes of inconvenience to our guests and guests of honor. I request the dignitaries on the dais to please felicitate our partners of this program. And I invite Mr. Suresh Kumar Singhal, Chairman of Prompt Packaging Private Limited, to receive the memento. Narendra. Invite Mr. Narendra to please come onto the dais. And I also invite the representative of Relicis. Thank you, sir. Thank you all. I request our office bearers and also our Sri Suresh Singhal, Vice President of FTC. And I request our office bearers to please felicitate our guest of honor for today's program, Dr. Padma. And Shri Dr. Subodh Dean Aski. FTCCI Sri Shekhar Agarwal Garu for his initiation and successful completion of bringing out the Vision Document 2030. Thank you all. And now I invite our Senior Vice President Dr. Meela Jaydev Garu to please propose the vote of thanks.
Thank you, Sujata Garu. అందరికీ శుభ సాయంత్రం. వేదికను అలంకరించిన పెద్దలందరికీ హృదయపూర్వక నమస్కారాలు. గౌరవనీయులైన ముఖ్యమంత్రి ముఖ్య సలహాదారు సోమేష్ కుమార్ గారికి మా ఈ ప్రోగ్రాంకి వచ్చినందుకు చాలా చాలా కృతజ్ఞతలు సార్. దీంట్లో మా డాక్టర్లందరికీ వినతి, ఎందుకంటే సోమేష్ కుమార్ చెప్పినట్టు ఉచిత భోజనం హాస్పిటల్లో ఇస్తున్నారంటే ఏ ప్రైవేట్ హాస్పిటల్లో కూడా అటెండర్కి ఫ్రీ ఇవ్వట్లేదు. ఇక్కడ ప్రైవేట్ డాక్టర్లు చాలామంది ఉన్నారు, అందరికీ తెలుసు. సార్ చెప్పినట్టు గవర్నమెంట్ హాస్పిటల్లో అటెండర్కి ఫ్రీ. చాలా చాలా ధన్యవాదములు. హాస్పిటల్కి వెళ్ళినప్పుడు అటెండర్కి ఏం కావాలంటే బిల్ ఎక్స్ట్రా ఇస్తారు, కానీ గవర్నమెంట్ హాస్పిటల్ లేదు. ప్లీజ్ కన్వే ద మెసేజ్ టు సీఎం ఫ్రమ్ అవర్ అసోసియేషన్ FTCCI, sir. Thank you very much. Please convey the message to him, sir. And Nageshwar Reddy garu ikkada ఈ ఇన్స్పిరేషన్తోని మేము ముందు ప్రతి ఒక్క కమిటీని ఫెడరేషన్ స్టాఫ్ మొత్తం బాగుంది సార్. మా దగ్గర ఇలాంటి ప్రోగ్రామ్స్ చేస్తుందంటే మీరమ్మా. ఈ మోల్డ్ క్రియేటెడ్ బై Shekhar Agarwal. This mold is created by Shekhar Agarwal. She is Dr. Sanjana, dental doctor. She is ఈ ప్రోగ్రామ్కి వచ్చిన అందరికీ మా FTCS తరఫున హృదయపూర్వక నమస్కారాలు. ముందు ఎన్నో ప్రోగ్రామ్స్ ఇలాంటివి చేస్తాము. మీ డాక్టర్లందరికీ రిక్వెస్ట్ ఏంటంటే ఎవరైనా ఇక్కడ ఫ్రీ క్యాంప్ పెట్టుకుంటామంటే ఏ హాస్పిటల్ వాళ్ళకైనా హాస్పిటల్ ఒకటి. థ్యాంక్ యూ వెరీ మచ్. విష్ ఆల్ ద బెస్ట్. అండ్ వీఆర్ హ్యావింగ్ ఎ డిన్నర్ ఎట్ గ్రౌండ్ ఫ్లోర్. ప్లీజ్ హ్యావ్ ఇట్. Don't miss the dinner. Thank you very much.